Hey everyone, it's Dr. Wood again, and I want to go through our research proposal. I talked about how the research proposal will be due pretty soon here, but I want to give you an example of one might look like, something you can use as a kind of a jumping off point when formulating your own yourself. Now here's the syllabus that I have pulled up here. If you look at the research proposal here, you're going to see this is craft an original draft research proposal addressing the research problem, any questions that come along with that, the hypothesis, the purpose of the research, and then the impact on the physician assistant on whatever relevant topic you're talking about, whether it be diagnosis of PE, whether it be traumatic brain injury in high school athletes, whatever the case may be. These are the things we want to address in our research proposal, essentially. So here's the example one that I posted online, and so I know this might be a little tough to read. So I'm going to zoom in here a little bit more. But as you'll notice, I added a few comments in here just to give you a little more information, a little more context on all of that. So let's say here I wanted to write a research proposal. And again, I kind of wrote what I knew or what I know. And so this is based off of the big kind of capstone research project I did for my fellowship way back in the day. So basically I said, okay, here's my title: optimal management of patients bit by coral snakes. Okay, so starting out with our statement of the research problem. Due to the coral snake antivenom no longer being made, clinicians must be judicious in their use of existing supplies. Due to a high rate of non-venomous bites, or bites where basically the patient does not get any venom injected into them, many patients receive antivenom unnecessarily. Currently, there's no evidence-based guidelines to determine who needs it and who doesn't. Okay, so that's a problem, right? Because we don't have any more antivenom being made, so we need to find out who really needs it, who doesn't. So that's the problem, essentially. So the question is, should all patients with a history of coral snake bites receive antivenom, or should patients not receive antivenom until they develop symptoms, right? So if you're curious, or if you remember from taking my class, you remember that coral snakes have primarily a neurotoxic sort of venom, where you're going to see things like diaphragmatic weakness, you're going to see things like dysarthria, things like ptosis, things like that will develop. Should we wait until they have symptoms, or should we just give everyone who has a history of a coral snake bite antivenom? Okay, so that is a research question I wanted to try and answer with my research, right, with our 10-page paper we're going to be using here. So the hypothesis. Now, again, remember, hypothesis is going to be basically my guess of what I think I'm going to find. I may be wrong, but that's okay, right? You typically want to go into it with an idea of what you're going to find. It's okay if you're proven wrong, right? It's the whole point of research. But my hypothesis in this case was that patients who do not receive antivenom until they develop symptoms will not have worse outcomes as compared to asymptomatic patients, okay? And basically what I'm saying is that if you don't get it, you're going to do better, or at least not worse, than people who empirically receive antivenom. Okay. Now, in this case, you want to think about, okay, that's my hypothesis. What is my null hypothesis? Remember, null hypothesis is basically there's no difference between the two different treatment strategies, right? So in this case here, the traditional logic was, well, if you don't get antivenom empirically, you're going to do worse because you're going to develop all these symptoms, etc. That's the null hypothesis. That's what kind of the tradition would tell you is the case. And so my hypothesis was saying, hey, I think this is different, right? I think you can withhold antivenom and it's probably okay for them, okay? So that's a hypothesis. That's what you want to come up with in regards to your particular topic here. Okay. Now, the purpose of the research here we're trying to say is that this research is going to review existing literature to determine if coral snake bitten patients can be observed and only receive antivenom when symptoms arise. This will allow for more judicious use, blah, blah, blah. So basically just saying like, well, what am I trying to show with this? Okay, what is the whole purpose of this in terms of how is it going to improve patient care? What's it going to do for our patients here? And again, this is going to allow for more judicious use of antivenom supplies. Great. Or I have a better way to diagnose PE, or I have a better idea of the optimal treatment for, Caucasian people with hypertension, whatever the case may be. One thing I do want to note here, we do not use I statements in medical research. This is not a personal thing. It needs to be kept such that you say things in terms where you don't use I statements, right? So you don't want to say, well, I think that blah, blah, blah is going to happen. You don't want to say that. Just say, this is going to happen. Or you can say, sometimes you can get away with a we, but basically you can say something like, the hypothesis states that blah, blah, blah is going to happen. You want to try to avoid I. Again, that's just a typical thing you're going to see in medical literature. If you try to submit something like that with a bunch of I statements to a journal, you're probably going to get returned with a lot of revisions just based off of that. Okay. And then finally, the last question here I want to have is the impact on the physician assistant. Now note, obviously getting better ideas of how to treat coral snake envenomated patients does not just affect the physician's assistant, it also affects doctors, pharmacists, toxicologists, etc. However, I want you to kind of think about it because, again, all you really know is PA. How's this going to be affecting your particular work here, right? So in this case here, I said, well, this is probably going to be affecting patients or PAs that are working in emergency medicine and critical care because that's where you're going to most often run into these patients and make decisions about whether they need to get antivenom or not, right? So again, it will allow them to make a better informed decision about who is going to need antivenom versus who isn't. Okay, so again, I want you to think about it back to your profession, how you're going to be able to improve care delivered by PAs, right? So this is the general idea. Again, notice this is not some long, drawn out, involved thing. This is quick and dirty, but I want you to at least have an idea of where you're going to be going with your research, right? Notice here, you may not have all your references together. You may not have all the data set out. It's okay, right? This is the early stages here. This is just the proposal. Again, with it being fairly short, if you decide to change your mind when you get a few more, say a week or two in, you realize, I just really hate coral snakes. I really do not give two flips about them. You can change it, right? You still have a little bit of time to do that. And again, any kind of changes in your idea need to be approved by me, okay? With that, if you have any questions, feel free to let me know. And I look forward to reading your proposals. And again, once you have a grade for this, which I will grade this over the weekend, once you have a grade in, then you will, basically that's the approval, right? I may give some comments to maybe ways you may want to consider focusing the research a little bit. Sometimes you may have it a little too broad. I want to try to bring it in. Sometimes it may be a little too narrow and I want to maybe expand it out a little bit. Take those comments, kind of think about them. If you have further questions, let me know. But once you have that grade, you're then safe to proceed on and start the next set of work, which is going to be a reference list. And again, any questions, let me know, and I will talk to you guys next time. Thanks a lot, and bye.